Hey everybody, and welcome back to another video from the Get My Body Working YouTube channel. I'm Muzz Stewart, UK-based physiotherapist, and in this video today I want to talk about tennis elbow, how to diagnose and how to treat it effectively. This is what I do in my clinic. I hope it's useful for you. Okay, so now the first thing you want to know about tennis elbow is, where are your symptoms actually coming from? Is it coming from your elbow or is it coming from somewhere else? Those somewhere else places might be your shoulder or your neck. I've had loads of patients that have come in and their elbow pain has actually been coming from their shoulder. Now, if that's the case for you and you tried the things in this video and they don't seem to work and they're not too convincing that it is tennis elbow, in other words, your symptoms don't seem to be coming from your elbow, check out my shoulder video. That could be very, very useful, especially doing that sleeper stretch. If that reproduces your elbow pain, then bingo, it's not tennis elbow, it's highly likely to be from your shoulder. Now, if your symptoms are coming from your neck, you're best to go and see a medical professional who can help you diagnose and work out what's going on in your neck and why it's referring down into the elbow. I will have a neck video at some point, and that may be useful for you as well, but you'll have to wait until that one comes out. Okay, now let's crack on and assess your tennis elbow. Now the first question is, what is tennis elbow? Tennis elbow is essentially pain in the lateral aspect of your elbow, and it's related to the extensor muscles of your forearm. Now, in my humble opinion, there's an imbalance between the extensor muscles and the flexor muscles, and it's usually related to some kind of load imbalance, load tolerance imbalance that you get yourself into. Now, it's not always playing tennis. You might be moving house, lift something heavy, do some gardening or something like that. Something that means you do an unaccustomed or unconditioned amount of gripping or forearm use, which always sounds a little bit funny, which overloads these muscles here and they get tired and tight and painful. And that can go on for quite some time and the pain can really get severe. So that's essentially what tennis elbow is. Now, of course, the cure for tennis elbow is to first of all identify what's causing it and then reverse that. So that's what we're going to go through now. So let's assess for tennis elbow. Now, there's a cluster of 5 tests we need to perform to see whether you have tennis elbow. You get 1 point for each positive test. And of course, the more points you get, the more likely it is you have tennis elbow. Now, these tests can be a little sore, but hang in there. They will give us some very, very useful information to help us diagnose and work out what to do to sort your tennis elbow out. Okay, now, in no particular order, test number 1, pain on palpation. Okay, so let's have a feel around your elbow. So there's an elbow. Find the bony bit. So if you find your olecranon process here, this sticky outy bit here, make your way around to this other bony bit here, and then is it sore around there? Have a good poke and prod. Roll your fingers around or over the bones there. If that's really sore, you've got a point. If it's not sore, make your way into the soft tissue areas and give that a good poke around. Is that pretty sore? If the answer is yes, okay, that's 1 point. If it's not sore, don't worry, moving on to the next one. Okay, so the first one is pain on palpation. Test number 2, pain on gripping. So simply make a fist, give it a good squeeze. Does that give you a pain? Yes. I'm afraid that's point number 2. If it didn't give you any pain, I'd suggest you pick up something like a little cloth here or an old pair of socks or something or other. Give it a good squeeze. Oh, crikey, that gives you my pain. Right, that is point 2. Okay, now if that didn't cause you any pain, don't worry, moving on to the next one. Now, test number 3. Okay, pain on a stretch. Okay, so we're simply going to straighten out the elbow. Of course, the forearm muscles cross the elbow. So straighten out your elbow. Bend your wrist down with your other hand, grab your knuckles and gently but firmly pull. Does that give you a nice painful stretch down that forearm? If the answer is yes, that's point 3. Now I'm going to turn this direction. Creaky bench, apologies about that. Now if you watch my elbow, I'm going to twist it up towards the ceiling. So I'm kind of twisting it up towards the ceiling. And then you pull a bit more on your wrist. If that really gives it a good stretch in there, then that is positive. So that is your 3rd point. All right, and again, if that didn't cause you any bother whatsoever, don't worry, moving on. Okay, so that's 3 points for some of you. Okay, test number 4. Now that's the classic tennis elbow test, okay? So what you need to do with this one is, again, extend your elbow, extend your wrist and your fingers, so you're in that kind of position, okay, if you can see there, all right? And I'm going to take my other hand, I'm going to push down pretty firmly on my middle finger. Oh, that gives me my pain. Okay, that's point number 4. Now, have a good push in there, give it some welly, and obviously if that's giving you your pain, then that's a positive test. If it isn't, give the back of your hand a good push around. You can see there, just give it a good push there, really try and load it up and see if that gives you your pain. And of course, if it does, that's point 4. Now, if you're sitting at 0 out of 4, I would strongly suggest this isn't tennis elbow. This is probably coming from somewhere else. Like I said, check out my shoulder video, see if it's coming from there. If it's not, it might be your neck. And if you're not sure and you're a bit lost, best to go and see your healthcare provider and get them to have a look at you and give you their opinion. Okay, test number 5. Now this is a nerve stretch test. It's for your radial nerve. Okay, now it can be quite sore, so we'll just see how you go. Be gentle with it, okay? Okay, I've moved back a little bit so you can see my whole arm. Okay, so this is the radial nerve test. So what you need to do is take the testing arm. You want to reach down towards the floor, drop your shoulder a little bit. Then you turn your hand around like that, palm facing out the back, bend your wrist backwards. And I want to know, is there any pain or pulling or tension in your sort of tennis elbow pain area? Now, if that's the case, that's a point. For some of you, that might be 5 out of 5. You definitely have tennis elbow. If it's not convincing, take your arm out to the side a little bit. That'll increase the tension in your radial nerve around your elbow. If that reproduces your pain, again, sorry, that is 1 point there. And if you can lift your arm up and move it around like that, and it doesn't give you any pain at all, your radial nerve's probably absolutely fine. So that might be 4 out of 5. Okay, cool. Now, if you scored 0 out of 5, it is unlikely you have tennis elbow. But if you still have elbow pain, I would certainly recommend you go and check out my shoulder video and see if that reproduces your symptoms. I've known plenty of people where that is the case. But if it doesn't reproduce your symptoms, or you're thinking, where do I go now? You really should go and see your healthcare provider for their expert assessment and opinion about your elbow symptoms. Okay, for the rest of us with tennis elbow, I'm going to go through what we need to do now to get it sorted out for you. Okay, everybody, now we've had a go at those 5 tests and we've diagnosed ourselves with tennis elbow. Now, the thing we really need to do before we get going is to compare some of those tests to the good side, because the answers are on the good side. So remember, you did your tennis elbow stretch and you thought, oh crikey, that's pretty tight. Let's have a quick go on the good arm. Okay, so same procedure, elbow straight, bend your wrist down and pull, twist the elbow up towards the ceiling. If that's not as tight, then that is a major contributing factor. Now, of course, the solution for tennis elbow, as far as I'm concerned, always revolves around improving your strength and your flexibility. So that's what we're going to do now. Now, if that stretch was tight, this is the main thing we need to be doing, okay? So that stretch again, elbow straight, bend your wrist down, grab your knuckles and give it a gentle but firm pull, and do the elbow twisting trick like I'm showing you there. Now, you're holding your stretchers for at least 1 minute. Now, if you're like me, you like to hold your stretcher for 2 or 3 minutes, but 1 minute will certainly do the job. And you want to try and do those stretches breakfast, lunch and dinner. That length of time for a stretch and that frequency throughout the day should improve your flexibility and hopefully reduce your symptoms within 24 to 48 hours. So it's definitely worth a go. For some of you, that may take a little bit longer, but for most of us, things should be on the up rather quickly. Now, the other thing is strength. If you found that gripping was painful and aggravated your symptoms, then that is another major contributing factor to tennis elbow. Your weak extensor muscles here, or your extensor muscles that aren't quite strong enough, that's probably a better way to put it, didn't handle what you gave them to do and they've reacted. So the stretcher should get you sorted out, but really we want to get these muscles a lot stronger to tolerate the demands that you're placing on them. Now, this is my 5 kilo gold dumbbell, okay? The reason I've got 5 kilo gold dumbbell was because I was trying to play actual tennis and I was trying to hit the ball as hard as I could like Roger Federer, and I overloaded my arm on a weekly basis and the stretchers were doing a good job, but I wasn't getting anywhere with my symptoms. So I started doing some dumbbell forearm extensions with 1 or 2 kilos. My symptoms were improving, but it was only when I got good at the 5 kilo that my symptoms disappeared. So that's how strong I had to get. You may need to get stronger, you may not need to get that strong, but I'm just saying you generally need to get a bit stronger than you think. Okay, so grab your dumbbell. Here we go. I'm going to place it over the back of a chair. I used to do this on my sofa while I was watching TV, and I'd sit there and I'd do my exercises. It was a bit tough, but we got there in the end. Okay, so this is how I sorted out my... Okay, so if we're going to improve your strength, we need to do some weightlifting. So grab your dumbbell here, okay, put it in the hand you want to work in, and rest it over the edge of something. I'm using a chair here. I used to do this on the sofa while I was watching TV. It was tough, but we certainly got there. Okay, so the procedure is to extend your wrists and hold it there, okay? Don't go up and down, because we want to build up endurance in these extensor muscles. Your flexor muscles grip, and your extensor muscles have to proportionately oppose that grip. So they're not going to be any use to you if they're only going up and down. We need them to hold that wrist extended position. Now you'll find pretty quickly that this is quite tough, okay? So just hang in there, and we're going for endurance, okay? So bear with it, grit your teeth. We want to get these muscles working really hard. Now, if you watch my hand here, I'm just going to ulnar deviate, radial deviate, in other words, move my hand like that, just to give it some variety and make these muscles work even harder. Keep going, and you keep going until those muscles are fairly knackered, like now, and then you pop that down. Now, you want to try and get those muscles pretty tight. Now, you might do one session, you might do a couple of sessions. I'm going to leave that up to you, but of course, start gently and build up slowly. That will certainly aggravate your symptoms in the short term. The stretchers will reverse that. The stretchers will help recover. But as you get stronger and you can lift more for longer and longer, you'll find that your symptoms settle right down. Of course, there are other forms of exercise you can do for the extensor mechanism of your forearm. I used to use a Powerball gyroscope, which I found very useful, but it wasn't strong enough to get my backhand like Roger Federer. Good old 5 kilo gold dumbbell there did the job for me. But if you find another way of strengthening these extensor muscles that works for you, you crack on. Remember, you compare to the good side. If the good side is much stronger and easier to lift whatever you're doing, then that's what you're aiming for. But ultimately, keep going until your symptoms have resolved. Okay, everybody, I hope you found that really, really useful and informative. That's what I do in my clinic to assess, diagnose, and treat people with tennis elbow once I've cleared the shoulder and the neck of any symptoms. If you like that video, please hit the like button, subscribe to the channel for more great stuff. There's plenty more where that came from. And of course, leave me a comment and let me know how you get on. Thanks for watching, and let's get your body working. Woohoo! All right, guys, all the best.